Teen suicide, understanding the risk and getting help. Teenagers have their whole lives ahead of them, they're often told. The idea that a teen could be thinking about ending that life might be hard for their friends, families, or other people in their community to believe. But the risk of suicide should be on the radar of anyone who interacts with teens, says Dr. Pearson, a mental health expert at NIH. The rate of teen suicide has increased over the last decade. Suicide is now the second leading cause of death for teens and young adults in the United States. Who's at risk? Many things can increase the risk of suicide in teenagers. One major risk factor is experiencing a mental health issue like depression, anxiety, or trauma. Most people who die by suicide have struggled with a mental health condition. Other risk factors include a family history of suicide, violence, or substance abuse. Teens also experience many stressful life events for the first time. These can include a breakup with a romantic partner, trouble at school, violence, or conflicts with friends. Teens don't have the life experience to know that these things will be temporary, that they'll get through it, Pearson says. And they might think they'd rather be dead than feel the way they do at that moment in time, she adds. Persistent misunderstandings about suicide can also keep teens from getting the help they need, adds Pearson. Many people think that a teen talking about or attempting suicide are so-called gestures or cries for attention, Pearson explains. They don't think that the teen is in real danger, knowing when teens need help. Some of the warning signs that a teen is thinking about suicide are talking about wanting to die, feeling hopeless, or being trapped or in unbearable pain. If you are concerned about a teen who may be thinking about suicide, start a conversation, says Dr. Joan Asarno, a suicide prevention researcher and clinical psychologist at the University of California, Los Angeles. A conversation can just start with, "Are you okay?" or "Is there something that feels like it's too big of a problem?" Asarno explains. Pearson recommends that people start these conversations early, when they first start to feel that something's wrong with a teen. It's going to be easier to help somebody before they've really decided on a course of action to kill themselves, she says. But many teens have suicidal thoughts that go unrecognized. Keeping teens safe. Treatments are available that can help teens at risk of suicide. Underlying mental health issues like depression and trauma are treatable conditions, and there are ways we can help youths with these troubles once we know about them, says King. Talk therapy and medications can both be effective for many. Asarno and her colleagues recently showed that types of intensive counseling for teens and their families can reduce the risk of another suicide attempt by about a third. This counseling, based on treatments called cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, teaches coping strategies and life skills. Involving the family in suicide prevention seems to be more effective than just treating the teen, Asarno says. Her program counsels and teaches parents as well as the teens in their care. One thing any family can do to help protect a teen thinking of suicide is to talk with a healthcare provider about putting together a safety plan, she adds. A safety plan is a document the teen and trusted adults create together. It includes coping strategies and contact information for people who have agreed to help in times of crisis. A safety plan also includes commitments from the family to keeping the teen's environment safe, such as limiting access to hazards. The decision to harm oneself is often made in a split second. A safety plan makes the best decisions the easy things to do, Pearson explains. The family wants that, and the teen wants that.